Now I look forward to continuing this conversation by talking about the master plan for developmental services, and our next speaker, Amy Westling. Amy is the executive director of the Association of Regional Center Agencies, and as the executive director she really has her finger on the pulse of what's happening across the state, and she has deep experience with serving our community. She'll be presenting the work of the California Department of Health and Human Services and the Department of Developmental Services, which have gathered our community and stakeholders together to develop a master plan to better coordinate care across agencies and across silos to create a better experience for people with disabilities and their families. Welcome, Ms. Westling.
Thank you, Dr. Kripke. It's a real pleasure to be here. I'll go ahead and share some slides, and we'll start with actually an apology, and that is that I was anticipating having a co-presenter, and unfortunately she's had to be out of the office this week, so I am going to do my best to speak about the master plan and really do it the justice it deserves. So again, my name is Amy Westling. I'm the executive director of the Association of Regional Center Agencies, and I've been with the association about 13 years, about 8 as director, and prior to that worked for a couple of the state's regional centers, as well as Disability Rights California. So really look forward to diving in and talking about what the master plan is and the opportunities it presents for our community. Okay. So just want to start from the beginning. And so in January of 2024, as part of the governor's budget, there was the announcement that there would be a master plan for the future of developmental services. And the important thing to note in the language is this is the master plan for developmental services. This isn't a master plan for how regional centers support people or for how DDS supports people. This is intended to be a master plan for how the state of California supports people across organizations, across agencies, and really one of the key focuses is breaking down silos in care and services so that people don't have to do a lot of that work themselves. And that was really one of the foundational principles that former Secretary of Health and Human Services, Dr. Ghali, really highlighted in the opening of these discussions. So the plan is intended to, as Dr. Kripke said, outline the future for developmental services. And a group was assembled that's just shy of 40 individuals that represent a variety of stakeholders in the state, and began meeting in March of 2024 to tackle the question of what comes next. What does the developmental services system look like, and what do services for people with intellectual and developmental disabilities and their families look like for the next decade and beyond? In June of 2024, there was also the development of statute around this issue. And it requires not only the presentation of the plan this month in March of 2025, but it requires the Health and Human Services Agency to report annually on where we are in terms of implementing the various recommendations. There were a few key principles that were foundational at the beginning of this process and that we've really strived to be consistent and true to throughout the process. So the goal is to increase equity, to increase consistency and to ensure that services that and supports that people need to live their lives are accessible. And so not just that they exist, but that they're accessible for people. One of the things that the group learned early on was that there really needed to be a way to hear very intentionally from communities about what's important to them, because we know that participating in long public meetings isn't a good fit for everybody. And even though meetings have been held in Northern and Southern and Central California and the Bay Area, that doesn't mean that that is always the best opportunity to hear everyone's authentic voice. So there have been something like 70 or 80 listening sessions for key groups as well, with a particular intentional focus on hearing in a real and authentic way from our self-advocacy community. And really wanting to better understand, not only from families and from professionals in this system, what's working and what's not, and what changes they would like to see, but really taking the additional time to sit with self-advocates and hear their perspectives about what would improve their lives and how we can all be a part of that. As I mentioned, the draft plan is in process and will be completed this month. The master plan, of course, as I said, is committed to really making sure that equity is one of the things we consider as we develop each and every recommendation. And there has been consultation to support that in a variety of ways, from subject matter experts in the equity space, including those who work for the Health and Human Services Agency, to really help us develop a framework so that as we consider each and every recommendation, and there's a lot of them, that the question is intentionally asked: what are we trying to achieve? And at this point, what populations feel like they're being left behind, or which populations are being left behind? And how do we address strategies to ensure that we are intentional in not leaving people behind as we develop good policy? And one of the concepts we talked a lot about was that if we design things for people who today's system may not be serving well, then we're likely to serve everybody that the system supports in a better manner. So sort of designing in a universal way. And as the slide said, actively seeking out conversations and input from underrepresented and historically marginalized communities. Some of those are socioeconomic, some of those are self-advocacy communities, some of those are racial, ethnic, linguistic populations that we don't often hear from. And so really taking the time to listen and to see what ideas they want to bring forth to this conversation that ultimately impacts their lives in very real ways. The committee itself has met 10 times and has focused first, of course, on setting the values and the vision statement, what equity means, but also, as Erin Carruthers said just before me, wanting to be clear that what we're looking at is where do we build upon the strengths of this system? So not putting us in a position where the questions are raised about should we have an entitlement in California. We're the only state that has an entitlement to developmental services, which means if you qualify for services, you don't sit on a wait list for years to enter the system. We know we've got some issues with service access and with people not getting all the services that they need to support them. But in other states, Oftentimes people wait 15 years to begin receiving services at all. So we wanted to ensure that we built upon that strength of our system. The other thing that became pretty clear early on was that the committee itself really couldn't answer all of the questions and give as much detailed exploration of all of the concepts that it would take. This is a relatively small committee. As I said, less than 40 people, and they meet monthly. And so there was the recognition that we needed more in-depth conversations. And quite honestly, we needed more voices to be heard, and heard in a formal way. So there was the development last summer of work groups that would focus on 5 priority areas that had been surfaced in the initial conversations with the committee as a whole. And we'll go a little bit more into depth about their work. But when the call for work group members went out, there were about 100 slots available, and 900 people applied for those slots, which tells us there's tremendous interest in this work, and that this is something that is a conversation that is timely and that is really something that people are passionate about. Okay, so as I said, there were 5 work groups developed, and they really each agreed to tackle distinct areas of our service system, as well as to come up with recommendations for where we take these next. Of course, there are concepts that cross different areas. And so in the last few weeks, there's been some really intentional work to ensure that if 2 work groups happen to be talking about the same concepts, that those concepts have a home, if you will, in a specific work group. And that just ensures that all of the recommendations have the opportunity to be developed and have the opportunity to be thoughtfully constructed, and that recommendations out of the master plan about the same topics don't conflict with one another. So the first group is about person-centered service systems that that people served by regional centers and their families can trust. The second is timely, inclusive, and seamless services across all service systems. So this one really gets to the issue of coordinating generic services and how we can better support people across different agencies and organizations. The third group is really our group focused on workforce. And early on, it was surfaced that when we talk about workforce, we're not just talking about enough people to do the work. We're talking about people who bring the right qualities to the work and and provide high quality services, and that there is stability in the workforce, and that the work that's provided is, again, person-centered. Workgroup 4 is about consistent, transparent, and accountable and data-driven systems that focus on outcomes. So really seeking to answer the question of how do we define success in serving people with IDD and their families? What tells us we're doing a good job from an outcomes perspective, and what tells us we have room to improve, as well as increasing consistency across regional centers and ensuring that, again, people have person-centered goals and services, but that there's a little more predictability in the service system across the state. And group 5 is really tackling lifelong services. So looking at those things and services that need to evolve with time as people age or their needs change, but also looking at the question that I think Director Carruthers was discussing about adequate resources, which usually means financial. So how do we increase the federal funds that come into our system to support its work? Which at this point, our system relies on a little less than 40% federal dollars. So the expectation is that our service system, the regional center service system, in the next year, which begins in July, so the fiscal year 25-26, the expectation is that the budget will be somewhere around $19 billion. And the expectation is that about $6.5 billion or so of that will be federal dollars. So really focusing on how can we ensure we're getting as much federal money into this system as possible. Okay, and then let me move on. Quickly want to review the recommendations from each group. As I said, work group 1 is looking at individuals and families' experience and how to build trust in a person-centered way. And they have identified 4 key priorities. First is building trust in the regional centers and other systems, particularly for people of color. The next priority is ensuring every individual who meets eligibility chooses and receives individualized services. So again, the priority of person-centered service delivery. And that we also intentionally focus on looking at who's not currently in the system that should be, regardless of age, language, access, race, ethnicity, or location. Priority 3, ensure individuals have choice and control over their lives. So really ensuring that the power dynamics in the system are right, so that we are making sure that people are really driving their own service delivery and that they are in control. And number 4, ensuring equity of access and options in regional center services while still assuring a person-centered system to support consistency in the experience of families and individuals. So this is sort of that delicate balance that we have been looking at throughout this process. How do you ensure greater consistency while still not landing in a place of total uniformity at the individual level? So how do you build upon the strength of our system, which has been crafting services around individual needs while increasing consistency in the process that we use to get there? Work group 2 has been looking at, again, the issue of how to break down barriers between different systems that people with developmental disabilities and their families rely upon. We know that when disability enters a family, that means there are so many service systems and so many professionals that come into the family's life. And as the regional center system has gotten more complicated over the years, the same thing has happened with many of those other agencies. And what we hear from families is that oftentimes they find themselves trying to navigate those services and coordinate those, and they feel like that's pretty overwhelming at times. So this group is really looking at that, how to coordinate better generic services, making life transitions easier, better, and on time. And those are big transitions, such as moving from early start services, so regional center services for children birth through 2, to the school district, and then moving from the school district to adult services, because those are places where people tell us it feels like their services, sometimes there's hiccups in their services where they feel like they aren't getting what they need. Priority 3, help individuals and their families use community resources, and being intentional as we think about the supports they need to do that. Okay, work group 3, individuals and their families receive services from a high quality, stable, and person-centered workforce. So this group is really looking at expanding career pathways to develop a diverse workforce that reflects the community. One of the things that we know is that California is a very diverse state from an ethnic, racial, linguistic perspective, and that at times our workforce has not kept pace with the needs of various communities. And so finding ways to ensure that people receive services that are culturally competent and that are linguistically accessible to them. Priority 2, providing competitive pay and employment supports to recruit and retain high quality workforce. That includes people with developmental disabilities. One of the things that we're hearing more and more about is that people who are receiving services in some instances want to also provide services. And so how do we support that? But also, I heard the question a little bit earlier about keeping and developing a workforce when competitive pay is one of the challenges. And so this group has come up with some recommendations related to that, and creating clear roles and responsibilities for service coordinators to deliver culturally responsive, effective, and consistent services. So really making sure that we're clear about the role of the service coordinator and the supports that they provide. Work group 4 is the work group that I have the honor of sitting on. And the priorities that this group has been looking at, again, this group is really looking at not only issues around consistency, but transparency, accountability, and data-driven systems, focusing on outcomes. So again, the question that this group has sought to answer is, how do we know what success looks like? And then how do we drive towards that success? And how do we establish funding models to support that success? So priority 1 for us was ensuring the system has a consistent, equitable, and transparent interpretation of responsibilities by establishing some consistent standards, services, rates that are accessible and fair, and ensuring that as we talk to people about services, that it's simple and inclusive language so that people understand the service offerings, and so that they can raise questions and better find services that will meet their needs. The second is enhancing data and technology systems. The state currently in the regional center system uses data technology that's about 40 years old. And so one of the things that this group talked a lot about was how can we not only define success, but what are the important data points to measure? And then how do we develop a data system that is equipped to do that work and capture the information? And part of the other conversation was around ensuring that the data system makes people's information accessible to them, and that it enhances their experience as well. And then our third priority was strengthening DDS, regional center vendor and provider accountability for achieving equitable and person-centered outcomes. Workgroup 5, individuals receive quality, lifelong, person-centered services from systems with adequate resources. So again, there's a couple of concepts in here. One is about maximizing funding for the system, and the other is about wanting to ensure that services are available to meet a variety of needs across the lifespan for individuals. So one of the things that we know, as I discussed, is that Medicaid is a huge source of funding for the regional center service system. And there are different paths to get into Medicaid. So there are people who are eligible for Medicaid because they are on SSI. So there is a natural connection between the two. So if you qualify for SSI, you get Medicaid, which of course we call Medi-Cal here in California. But one of the other ways that we, as a regional center system, can support people in accessing Medi-Cal funding or Medicaid funding is through a process for children whose families make too much money for their children to qualify for Medicaid. And it's through a process called institutional deeming. And that's a really scary name, and it comes with a variety of forms that are difficult to navigate. But what it's really saying is, I'm choosing for my son or daughter to receive services in the community, and I would like the federal government to help pay for that. The other thing families get as a result of this, or their children get, is they also get access to other Medi-Cal services. But this process has been very challenging for people to navigate. And part of it is the forms and the names and just the very archaic way that we in California talk about this. Priority 2, connect different types of services that people with developmental disabilities use. And also make sure that those things are eligible for federal funding. So if we can capture more federal dollars as a state, as people get services from other agencies, which is possible, there are federal dollars for behavioral health, for regional centers, for schools. So making sure that we're maximizing those federal resources. And then, as I said, making sure that services are flexible and that the federal government pays as much as we can get them to pay for these types of programs, regardless of who's providing them. Okay. I'll go very quickly through just kind of the timeline for the plan. I see that there's some questions in the Q&A, and I'll get to those in just a moment. So the DDS master plan deliverable timeline, as I said, there was statute that requires the plan to be delivered to the legislature by the end of this month. So work groups are having their final meetings. My work group had its final meeting yesterday, and really sorting through from the priorities, recommendations for each of those and identifying which ones are ready and we know we're going to go in the plan, in the final plan, and which ones need some additional discussion. So the draft plan will be released on March 12th, and it will be posted publicly so people can get a preview into what's going to be discussed and what the final plan might look like. As I said, work groups are finalizing their recommendations. And then where there's any question about what needs to be discussed at the final master plan committee meeting on March 19th, those each work group has a set of co-chairs. One is a self-advocate and one is not. and the group of the co-chairs will meet to decide the structure of the March 19th meeting. So then the March 19th meeting will include the committee members, again, sorting through which recommendations are good to go and deciding which ones really don't feel like they are ripe for inclusion in the plan. And then there'll be a final cut where if there's any questions about what's in and what's out, the co-chairs again will meet and they will make those final decisions. And there will be a process for people to submit statements if they are displeased with the decision not to include a certain priority. So, and of course, there is additional information at this link all about the master plan process and opportunities for reviewing all of the materials from the various meetings and for catching up on in terms of where we are with the process. So with that, I will stop sharing and be happy to take some questions. I don't know, Dr. Kripke, if you want me to start with the ones in the chat.
Yeah, thank you so much. I'll read them for you.
Perfect.
Last year, it was in the news that regional centers in California returned $1 billion back to the state in unused funds. Can you please comment on this underusage of DDS funds and the systemic barriers of accessing regional center services, since families are still expressing they're not getting what they need?
Absolutely. So I think it's important to note that, yes, about $1 billion was sent back for that fiscal year. And there are a variety of reasons. But one thing I want to say is that regional centers committed to spending all of that money. So they had made arrangements and had contracted with service providers to spend all of that money. And actually had committed more. But the issues were pretty complex during that time. One of the big issues that we saw is that one of the things we track is what we call utilization rate. So how much of the services we've authorized are then ultimately used. And we saw during that period a drop off in utilization rate. And one of the reasons for that was we were coming out of the pandemic and the workforce issues were making it so that a lot of service providers didn't have the staff necessary to carry out the services that people needed. So what that meant is that some people had been authorized to attend a day service or receive supports 5 days a week, and their day program was only able to accommodate them 2 days a week. And so we saw significant drops in utilization during that period, and that's probably what led to a lot of the funding that was returned.
Thank you.
And I guess related to that question, is the staffing level back to where it was pre-pandemic? Or I guess, how is the staffing level now?
Staffing is an incredible challenge in terms of our direct support professionals who do the bulk of the on-the-ground work with individuals on a day-to-day basis. One of the hits to our system in terms of the direct support professional workforce was the pandemic. But quite honestly, one of the other challenges is that other industries have specific minimum wages that our service providers can't keep up with. So the minimum wage for most fast food employees is $20 an hour. And our rate models that service provider rates are built on assumes in many cases lower wages than that. And so that's the challenge, is how do you compete in a very tight labor market when compensation is a significant issue. The other thing that's important to remember is that our service system is growing incredibly quickly. So when I started with the association in 2012, we used to talk about our service system serves about 250,000 people, so 250,000. In the 25-26 fiscal year, we're expected to crest 500,000. So in that 13-year period, the population we're supporting has doubled. And so it's not just about retention of the workers we have, it's about expanding service offerings. And when workforce is a problem, that's our biggest issue. I can speak on behalf of ARCA. We are focused this year legislatively on trying to find solutions for the workforce issue, because that's really what's the biggest barrier between what people need and what people are receiving today.
As a follow-up question, the master plan presented today, what's the timeline for achieving these priorities and goals? Is it 5 to 10 years, or what's the timeline?
Yeah, so the Health and Human Services Agency is required to report over the next 10 years. And so that, while it hasn't been explicitly stated what the timeline is for the expectation to achieve these things, the fact that there's going to be reporting over the next 10 years tells us that some of these things are going to be achievable pretty quickly, and others are going to take considerably more time. And I'll be honest, a lot of it has to do with the budgetary climate. Some of these things are shifts in just the way we approach things and may not cost a lot of money, but some of these things, for instance, when we look at Workgroup 3 and their intentional focus on the wages of our workforce, those things cost money. And so those will probably be things that will take longer to implement in a phased process.
And a separate question that came up was, I guess this is, are there disparities between or among regional centers, and how do you sort of promote consistency so that the services that are provided are similar, high quality?
Yeah, so there's been a lot of discussion over the last few years about how, again, we can strike that balance between the local look, feel of services and greater consistency. And in fact, ARCA, on behalf of the 21 regional centers, started identifying places where consistency would be important about 3 years ago now, as we were having conversations with the Little Hoover Commission, and recommended some places that made good sense from our perspective for there to be additional consistency. So things like the assessment of the family support needs, so respite, daycare, personal assistance, but also things like how people contract with regional centers, so the vendorization process. And a couple of years ago, there was statute passed that requires the state to improve consistency and to come up with standardized methods for addressing a variety of things, including the intake process, the IPP process, data collection, some really important areas. And so that's some work that started ahead of the master plan and is certainly being built upon through this process.
So it sounds like things are in progress.
Things are always moving. What do they say? The only constant in life is change.
Clarissa, are there any other questions that before we go to break?
There's just one last one. Will there be any work to promote consistency? What about the consistency across regional centers? What is the plan for that?
Yes. Workgroup 4 has some pretty explicit recommendations related to consistency. And those include using the same definitions for services, and ensuring that when we say, for instance, independent living services, that we mean the same thing by that. We've started some of that work through the implementation of the rate changes, because the department has done some policy updates along with the rate changes. So some of that work is underway, but the work group is also recommending more consistency in the rules for qualifying for those services and how assessments are made about whether those services are appropriate in individual circumstances. So lots of discussion around this, again, with wanting to carefully balance consistency with person-centeredness. So separating consistency from uniformity.
Well, thank you very much for a wonderful discussion. And we have so many other questions to ask, but our time has come to a close for this particular session. But thank you so very much.
Thank you for having me. And again, my apologies for only being one of the 2 anticipated presenters. Have a wonderful day.
Fabulous.